Dear colleagues, a very warm welcome to yet another web series which is going to be jointly presented by Infection Control Academy of India, University of Hyderabad, with academic grant from Sanmed Healthcare, the largest manufacturer of disinfectants and antiseptics in India. As you all know, biosafety and biosecurity are fundamental elements of effective laboratory services and public health systems in the global fight against infectious diseases. Despite this central role, many laboratories still lack effective biosafety practices, equipment, and infrastructure to conduct diagnostic and surveillance activities in a safe and secure manner. These circumstances not only present a risk to laboratory-acquired infections among healthcare workers, but also present a risk of release of infectious agents back into the surrounding community and environment, preventing efforts to contain and control infectious diseases. So the objective of this IPC Masterclass, which is the series is going to be called as Biosafety, is basically to lower the risk of exposure at all stages in healthcare system where biological agents may present a risk to workers. Example, sample collection in the field, during the transportation, in the laboratory, in hospital, and also disposing those biohazardous material. So what are the biosafety risks we are talking about? A risk to laboratory acquired infection among healthcare workers and a risk of release of infectious agents back into the surrounding community and uh, and also into the environment. So the series which we are currently talking about is going to constitute 5 sessions over a period of 5 weeks, and all the webinars are based on country's current and future biosafety needs. And this is going to be built around all the key policies, standards, guidelines that control and inform the management of biological risks, and all these topics would be covered based on the standard guidelines, which are being prescribed by World Health Organization, CDC, NCDC, and various other organizations who are supposed to be the controllers and also the guideline issuers for this particular thing. And and the topics which we are going to cover in this series is going to be first and foremost the introduction to the concept of biosafety, its applications and importance in spheres of medicine, and then the second topic would be classification of organisms and relevant bio precautions with levels of biosafety. And third one is going to be biosafety violation and bioterrorism. And especially as you people all know, now, some people and some experts are pointing today the COVID-19 origin to be a bioterrorist kind of thing, which is originating from a lab in a country which you all know. So in that context, it becomes very, very important to discuss biosafety violation and bioterrorism. And the fourth of the topic in this series is going to be biosafety with class 3 and 4 pathogens and transportation of samples. I'm sure during this COVID-19 last 2-3 months, we have faced a lot of questions on how to safely transport the samples without creating a hazard, neither for our colleagues nor for our environment. And the fifth one, is going to be about the biosafety and vaccinology, which is again going to give us a right kind of approach in order to understand how we are going to secure our healthcare environment. This series is conceived by Dr. T.V. Rao, Dr. Ranganathan Iyer, and myself, and with a view that this particular topic, which is highly neglected, should be brought into the fore, and a right kind of knowledge and tools should be transmitted to healthcare workers so that they can de-risk themselves and also those people who are working in the healthcare environment. We hope this series too will find a good place in your arsenal, and I hope it will be well received, and the sessions which are going to be delivered by the experts will be useful in times of mega healthcare crisis like COVID-19. I wish you all the very best. I hope post this series, our healthcare environment is going to be much more safer, and we'll be able to deliver a safe care to all our patients. Thank you very much, and namaste.